were related to education of girls, universal access of education of women's rights. But Millennium Goals 4 and 5 are the ones that, even though we're not driven by them, these are the two that we affect most commonly. One is to reduce child mortality by 2/3 the number of under 5-year-olds who die, and to improve maternal health, to reduce by 3/4 the number of maternal mortality. Now, to give you an idea of that, in good hospitals in the United States, the death rate of women who deliver babies is about 3 out of 100,000. Now, Dr. Anderson is the obstetrician gynecologist here, but I mean, the 3 out of 100,000 women that die are often, as an internist and cardiologist, the ones I see, are women who develop things that we just don't know how to treat completely, like cardiomyopathy with extreme heart failure, or those with severe premorbid conditions, or sepsis that gets too far, or disseminated intravascular coagulation. But it's I mean, that's a good number, 3 out of 100,000, from the viewpoint that, I mean, that's as low as you can do it. You know, in contrast, we have about 1 in 5,000 Americans. So that would be 20 out of 100,000 people die in car accidents a year. So I mean, it's not a horrible medical number. But in underserved communities in the United States, and Amnesty International a year ago cited us for this, in underserved communities, you see that number go up to 60 out of 100,000. 60 out of 100,000 women die during delivery in underserved communities, which is 20 times that in other communities. Now, Amnesty International cited it, even though it's obviously a complex reason, many social factors, both the lack of access to healthcare, which is disgraceful to communities, but it's also conditions in which people come to the hospital eventually. So there are many reasons why poverty leads to higher numbers. In some sections of Ghana, in many of the sub-Saharan African countries I've gone to, the average number is closer to 1,600 out of 100,000 women, so that's almost 2%. In Eastern Congo, when I returned, the numbers in some of the areas are 7,000 or 8,000 out of 100,000. So you're seeing a completely different, this is why the Millennium Development Goal is substantially reduced this number. Ghana instituted in 2008, in the spring, free health care for women if they're pregnant for anything. Woman goes to the hospital with a stubbed toe, basically. If she's pregnant, it's free care. Their goal was to try and reduce Millennium Development Goals, but to show you the law of unintended consequences, in 2008, about 50% of women were delivering in villages and 50% in hospitals. The hospital mortality rate is better than the village mortality rate, unquestionably. But the number of women going to the hospital surged up, so there were a greater than 50% increase of hospital deliveries. Now the problem is many of these women came in late, so the benefit of the hospital wasn't as high, but they flooded the hospitals which didn't have the capacity. So you have a hospital that was delivering 10 babies a day, now doing 20, and it hurt the mortality of the population because they were overwhelmed. So the point is, without infrastructure, it's very difficult to achieve many of the Millennium Development Goals. So, Dr. It was my commitment at the Clinton Global Initiative in 2005. I photoshopped this because I needed a picture of Clinton. Actually, the meeting was part of President Clinton's foundation, and it was an innovative meeting. It was getting all these people together from various backgrounds, including regular people like me and superstars like Oprah, Bruce Oprah. And the point was, it said, if you go to the meeting, you'll be invited back, but you must make a promise to make a difference somewhere. You must do a project. And the first year, we didn't quite know what the scope of what they wanted, but everyone who went had to commit. In 2005, I was a clinical cardiologist running the intensive care unit at Lenox Hill, and I had only one developing world experience as of 2005, and that was Cancun on spring break, which I don't remember at all. But I had not been in the development world, so I didn't know what to do. And I'm not going to get into this story, it's too long. But I came up with doc to doc, doctors to the docs, which is, try and collect medical waste. And we've had a lot of support. President Clinton has actually endorsed us, and the reason why I have to say that is I don't know if we could have succeeded without him endorsing us, because when you're a new organization, you don't have necessarily any credibility until you have a track record. But his endorsement gave us a lot more credibility than we had earned by our own activities. And that brought us resources we probably wouldn't have had access to. So it helped our growth and development that he so vocally supported. So does Secretary of State Clinton. We get a lot of help from the State Department, and that goes a long way towards achieving our goals. So that's good. We collect surplus medical supplies and equipment across the country. We're not just collecting in New York. We actually get boxes of consumables shipped every day now. We get like 30 or 40 boxes a day across the country, multiple states. We also pick up, we're picking up, the American College of Cardiology called us up. There's a cardiac catheterization lab that's being dismantled in Las Vegas, and we're going to ship it. So we collect supplies and equipment across the country. But we do regular pickups in the New York community, which had no group picking up supplies before. Clearly, New York City is the largest concentration of medical community in the United States. It's the biggest healthcare city in the country, obviously with the most number of hospitals. Capital equipment and disposables. You guys do it. Capital equipment is a bed. Capital equipment is a pair of crutches. Anything that can be used more than once has a value because it's not consumable. You have like a suture you use once and it doesn't have a permanent value, or a bed does, or a sonogram, or an incubator, or a monitor. These beds were being thrown out and going to landfill. They replaced that bed I showed you in Ghana, in Kumasi, with that mattress that was cardboard. I mean, it's astonishing we'd send these beds to landfill with linens. We've collected an ambulance, which broke my heart to give it up. You don't know what it's like, the traffic in New York, it's like getting pizza on a Friday. Can you imagine keeping the ambulance ahead? I know it's kind of probably a boy fantasy, but I mean, it was so cool. We sent to Uganda, Kampala, we're helping them build an oncology program, and this van was one of two vans we sent them, filled with mammography equipment. One of them was donated by the Dana-Farber Cancer Center in Boston, and the other one by Yale Medical School. So we've got very interesting single gifts, and we had a company ship it for free, and it was driven across from Mombasa to Uganda, and it's beginning a cancer recognition program. Although many of you may not know what cancer is the #1 killer of women in Africa. Do any of you know? Except for the people I told last night, don't you? Anyone know? It's cervical cancer. Cervical cancer is the #1 cause of death of women for cancer in sub-Saharan Africa. And we've helped build up some of those programs. This is Dr. Isaac Boateng in Tepa, the Ghanaians who were here. We sent a container up there, and he got this sonogram. This one was going to landfill, plus a container. This is the first woman he's doing a sonogram on in his village. We came back for 3 months later, April to July, to see what the impact was of receiving this sonogram. And he said, because they delivered so many things, over 100 a week, he said that in the first 3 months, he diagnosed with the sonogram